Welcome back to another episode of On the Right Track. I'm John, this is Carter. Today's topic will be depression.
Yeah.
So the last two podcasts we talked about pain, and then we talked about lower back pain. And today we're going to kind of expand on
the mental aspect of pain and how it can impact our prognosis.
Yeah, and how certain cognitive effectors like depression can affect your perception of pain. So
Right.
you want to start us off?
Yeah, so depression can be basically boiled down from the DSM-5 criteria to get diagnosed with depression from a psychologist. You have to meet a certain amount of criteria. And so we're going to talk through the PHQ-9 today, which is the expanded version, which if you go onto the DSM-5 for depression, it's just the breakdown. And so number one is essentially little interest or pleasure in doing things. And this can have implications on our treatment. And so essentially I'm going to go through all 9 and we'll talk about how that can change treatment or change your pain or change your prognosis.
This is for the PHQ-9.
So PHQ-2 is actually just the first 2 questions of PHQ-9. And so we can screen using the PHQ-2 for a risk factor, essentially. And so the first one of PHQ-2 is little interest or pleasure in doing things. And so like if you're going to physical therapy, you're waking up and you don't want to go to physical therapy, you don't have interest in getting better, that's obviously going to hurt your prognosis.
Mm-hmm. So the PHQ, we keep saying that PHQ stands for Patient Health Questionnaire, and the 2 is an indicator for how many questions are involved in that questionnaire, and it's scored from 0 to 3, or each question is scored 0 to 3. You add up the scores of the 2 questions, and if it's 3 or more, then you take the whole PHQ-9, and that should give a healthcare provider insight on whether or not you're being affected by depression. So I took it this morning because I was having some symptoms of depression. I don't sleep very well, and I haven't had a couple of days I've had some disinterest in doing things, and so I took it and I scored I think I said an 8, which falls under mild depression. However, on the PHQ-2, I only scored a 1. So technically I shouldn't have taken the PHQ-9.
Right.
But it is what it is.
That's because the PHQ-2, these first 2 questions of the questionnaire, little interest in pleasure doing things or feeling down, depressed, or hopeless. So if you feel hopeless about your condition, right,
Mm-hmm.
that's a poor prognostic of being able to return to normal function, right?
Mm-hmm.
And so those 2 things, if you're fine, like if you have no days of the week where you feel little interest or hopeless or feeling down, then you should not continue on the PHQ-9. But we'll continue on. So what's number 3 of PHQ-9?
Number 3?
Yes.
So trouble falling asleep or
Sleep too
staying
bad,
asleep,
right?
or sleeping too much. Yeah. So like whenever I get stressed out, the first thing that gets affected is my sleep patterns. I try to get 8 hours a night like it's recommended, but I end up just kind of rolling around in bed and just keep changing my position, can't get comfortable, can't sleep, and it's just because my mind is racing. I do have like a normal nighttime routine. I try to make it as simple as possible to help my sleep, but it's just whenever I get in those stressful states, I end up sleeping 2 to 4 hours a night. It's not good.
Yeah, well, I did an article over the weekend about how to improve your sleep. And basically what I found from my research was your bedroom temperature should be between 60 and 70 degrees Fahrenheit, so pretty cool. And it should be dark like a cave. There should be a minimal amount of light. Basically, the only light there should be is that when you get up in the middle of the night to go to the bathroom, you don't trip and hurt yourself. That's the only light you should have. And also, you should minimize stimulants and kind of front load that towards the beginning of the day and then cut it off by noon, because like caffeine's half-life is 5 hours. So if you're drinking a cup of coffee at 5 p.m., by 10 p.m. it's like you're drinking half a cup of coffee before you get to sleep. That should help decrease your stimulation of like the fight or flight reflex.
Yeah, so next one, feeling tired or having little energy. So of course I'm going to have little energy because my sleep patterns are off. So that also affected my score. But I think the question is really trying to get at is like, how is your general mood? Is it because you're not sleeping, or is it because of some underlying factor?
Yeah, so like I think feeling tired and having little energy, that could stem from a lot of things. It could also stem from poor nutrition or even poor sleep, right? So like if we're not sleeping, we're not flushing our brain of toxins from the previous day, or if we're not sleeping, we're not repairing our tissues, so we could be feeling, I guess, in a depressed state for things that are holistic, not necessarily mentally sourced.
Mm-hmm. Yeah, I think that kind of goes into the next question too, poor appetite or overeating. So if you start getting out of those rhythms, for me it's routine. So like like this last week we had a snowstorm and we were all snowed in, and it really heavily affected my routine. I like to wake up and go to the gym first thing in the morning, and I have a whole daily routine after that. But this last week, it was just all thrown off. It was all hectic. So
yeah, I think routine for many people keeps them in between like a healthy bandwidth. It kind of bookends them from under eating and overeating, so you kind of fall somewhere between there. But when your eating becomes disordered is when you fall out of that routine.
Mm-hmm.
You should probably consult a nutritionist or a dietitian at that point, because nutrition can be dangerous if you are anorexic or you're bulimic, or you might not be getting the quality protein or the minerals that you need to repair your tissues if you have low back pain, and that's going to kind of prevent you from healing.
Right. Feeling bad about yourself, or that you are a failure, or have let yourself or your family down. I scored a 0 on that one. I don't feel bad about myself. I know I'm doing everything I should be doing, so
right.
Like, it's just stress factors that are affecting me, I think.
Yeah.
So
I think, this can come back to the self-efficacy or feelings of self-worth.
Mm-hmm.
And I think many people feel behind in life. So like if you look at your peers, or if you look at someone successful, like, I'm not Elon Musk, I don't have my own personal rocket factory.
Mm-hmm.
Or hey, that man has a Ferrari and a nice woman in the passenger seat, right? But you don't really know them, right? So you should really just be focusing on yourself and your own actions, and bring the power back within your locus of control, and that should reduce the symptoms of like feeling like you're a failure, because just try to do a little bit better than you were yesterday. So that's what I try to do every day. It's like I work out so I can be a little bit better tomorrow than I was today, and that helps me keep that positive growth mindset moving forward.
Right. Number 7, trouble concentrating on things such as reading the newspaper or watching television. I also scored high on this one. I had a 2 out of 3 on this one, because most days this last week my concentration was just not there. We had class online instead of in person. I was not paying attention to any of them. And my sleep's off, my routine's off. It's just it's kind of a cascade effect. Like all of these questions are slowly being affected one at a time. So that's why addressing these things individually and coming up with a routine is so important. And I think that's just going to be the pattern for the next 2 questions as well.
Yeah, and I think it's important to relate this back to back pain. So like if we as the physical therapist give you a exercise and you also have the comorbidity of depression and maybe ADHD or whatever, you need to understand the education, but like we as therapists need to create that like education of why it is important to push past the lack of concentration and actually do the mobility work or the exercises that we have for you. Because if you don't do them, you're not going to get better. And I think if you are depressed, having a painful low back is going to make your depression worse, and vice versa.
Yeah.
So these two kind of feed off each other and make each other worse.
Yeah. So let's just get through these next two questions real quick, and then we can talk about why we care as physical therapists about treating depression, and then how we can treat depression. So number 8 is moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety and restless that you've been moving around a lot more than usual. And then number 9, thoughts that you would be better off dead or of hurting yourself. So,
Right. And so I think number 9, like suicidal ideation, is important. Like, go speak with somebody, go connect yourself with a resource that'll help you out in the long term. Because it's kind of hard to deal with individually, or that's not something your therapist can help you with.
yeah, and we're taught that like having those ideations, especially if you have a plan, can be a medical emergency. So getting immediate help is very critical, and I think that one should be like a question in itself to like automatically qualify them for counseling. That's just my personal opinion.
Yeah. So that concludes the PHQ 9, right?
Mm-hmm.
And so, what are some interventions that we can do to improve those symptoms and increase the prognosis for depression? I think my personal favorite would be aerobic exercise, because you're kind of attacking most of those vectors at the same time. Because when you exercise, you release what's called enkephalins, or these endorphins, and these are like basically happy pills that you release endogenously or within your own nervous system.
Yeah.
And so I think that could help with sleeping too. I think it could help with appetite. I think it could help with, the anhedonia, or the lack of pleasure, because you get that quote unquote runner's high.
Mm-hmm.
So I think that'd be my favorite intervention, is like 60 minutes of steady state cardio, or like a high intensity interval training.
Yeah. I think that's probably one of my top ones too. So why we care as physical therapists, why we treat depression as well as whatever condition they have, is because when they have comorbidities like depression, it can affect the severity and disability that their pain causes. So in the instance of lower back pain, what should be, a 2 or 3 out of 10, like if it's just some sort of muscle soreness or muscle tightness causing the pain, they experience it as a 6 out of 10. Or this case that we read, sometimes you experience a 10 out of 10, 50% of the time, which shouldn't be happening.
Right.
So I think consistent exercise, and then I think you were going to talk about like pharmacology.
Yeah. I think, I am not a pharmacist, but I do think these interventions can be cool. And I want to talk about bupropion, which is based, I don't know if I'm pronouncing that right, that's Wellbutrin, which you probably know. It's an NDRI, or norepinephrine and dopamine reuptake inhibitor.
Mm-hmm.
And so what's cool about that is that if we work as clinicians, physical therapists, with a psychiatrist, this medication is indicated for pain relief of low back pain and for the treatment of depression simultaneously.
Mm-hmm.
And so I think I'm not going to give medical advice, but like that would be indicated if you have these two comorbidities of low back pain and depression. And I think most people start off with like an SSRI, like serotonin's reuptake inhibitor, which is basically your place in the hierarchy. And so if you feel like down, defeated, more serotonin will help you feel that self-efficacy that you might be lacking.
Mm-hmm. And then the last thing that I think is incredibly important to the treatment of depression, as well as any type of chronic pain condition, is cognitive behavioral therapy, or CBT.
It's a great intervention.
Yeah. So basically, it's just like behavioral concepts that you can learn, and even PTs can kind of coach these. It's better done by like a mental health counselor, but we can make some sort of change with it. And it can, I think the biggest thing it does is it reduces the dependence of these patients on like pharmacological interventions. So people with depression, usually they're at a high susceptibility of developing substance abuse problems, especially with opioids. So if you can limit that susceptibility, I think that's incredibly important.
Yeah, the statistics are also pretty impressive with CBT because cognitive behavioral therapy has been shown to improve depression by like 40% in like a study with the VA population, and it's also been shown to relieve chronic low back pain in like an outpatient setting for physical therapy. So it's kind of like that dual task. You're attacking the depression and the low back pain at the same time with the same intervention. And I think a limiting factor is price with CBT, but I just recently learned that social workers can also administer CBT.
Oh, yeah, very cool.
So that might be more affordable and available because there's not a lot of psychiatrists or psychologists, but there are plenty of social workers out there.
Yeah.
And important for CBT, like you said, right? Reduce opioids, right? Try to choose healthier coping mechanisms like CBT, because long term you're not going to be destroying your cells with analgesics, and instead choosing healthier therapies like running or CBT.
Mm-hmm. All right. Well, I think that was a good little podcast we had.
Yeah.
Do you have anything else?
I don't, guys. So just make sure to drink your water, sleep 8 hours, and
have a regular diet.
Yeah, have a regular diet. Exercise 6 days a week, 60 minutes a day.
Most days, we don't have to go crazy for 6, but if you can do 6, like that's great.
Yeah. Well, thanks for joining us for On the Right Track, and we'll catch you next time. Peace.
Peace.